If you're dealing with knee pain and suspect hypermobility is to blame, you're not alone. Here's how to understand the pain and find real relief. The knee joint is a very tight joint and not as forgiving as many other joints. It typically is stuck between a dysfunction between the hips and the ankles, which means it starts initiating the movement, and that causes injuries, subluxations, and pain. Most often, knee joint injuries are from forward shearing of the joint, and hypermobile knees, it's very common for the kneecap to move over the knee joint easily, causing pain and issues. So one of the first things that I focus on treating patients with hypermobility and knee pain is bringing attention to the feet and trying to get to connect with the hips and the pelvis. Wearing arch support and high top shoes to minimize the chances of ankle injury is so important. Being able to spread your toes and try to balance on the feet without collapsing the arch allows the brain to see that it can rely on your feet and ankles, and that doesn't typically happen with hypermobility. I strongly recommend placing your hands on the sides of your hip joint so the brain gets to see the hip joint's location more clearly. In general, it's the tensile contraction of your ligaments, how your brain see the joints better, and when the ligaments are lax, we can use the sense of touch to help. So now let's do this together. Go ahead and stand up, place your hands over your hips so the brain sees your hips, and then see if you can see the bump on the outside of your ankles in your head. If you can, put something like icy hot over the ankle, this area, to basically tighten that sensation so the brain can see it better. Now try to line up the hips, the balls here, with the bump on the side of your ankle, so the pelvis is not in front of your ankles or behind the ankles. When they line up correctly, there's no reason for the knees to have to do more than what they're designed to do, and decreases the chances of knee issues and a beginning step in the right direction. This basically means you won't go into that hyperextension of your knees, which we all know is an issue. So if I'm all the way here, I go into hyperextension more. We need to understand the correction of dysfunctional patterns of movement and instability in the posture is a process, not an event. It's not one exercise that fixes a problem, but a series of things that need to be in place in order for us to basically be having that balance and stability we're all looking for to decrease the chances of injury. If you have not subscribed to the channel, and if you're not following me on social media, you may want to do something about it now. And if you need help with your hypermobility, make sure you contact me. Until next time, take care.